Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank all of our listeners for liking, subscribing, and sharing our podcast with your friends and family.
And if you have any topics or questions you'd like to submit, you can do that at sgmc.org/podcast.
All right. And today we are here with Cherise Giddens, who is a nurse at SGMC Health and is also our Vice President and Chief Nursing Officer. So, Cherise, what brings you in today?
So I came today just to talk a little bit about nursing at SGMC Health.
All right. And I typically worry when we get doctors sitting in these chairs because I'm like, they're going to get calls, they're going to need to get up. But I'm actually probably the most nervous about you sitting here because you are probably the most active person in this building, I think, as far as getting phone calls and just staying on the go and troubleshooting everything. But
yeah. Firefighter.
Yes, firefighter.
I feel like a firefighter.
I like that. I like that. Well, tell us a little bit about your career because you've been here a long time. So just start us out. Give us your background and history.
So I have been here a long time. I feel like everybody's grandmother some days. I've been here for 38 years. I started off in women and children. Worked for Pat Miller. So she kind of grew me up in this organization. So started off in the nursery. And then I went to pediatrics, and that was where true love was with the kids. I love kids. So then I went to a manager role, was PCC, went to a manager role, and just progressed over the years. And so this is where I landed.
Awesome. Well, we love having you in this role. I think you're doing an awesome job. I've also got to kind of witness your transformation. And it's certainly earned because you are a powerhouse, I feel like, in the nursing world.
Well, thank you.
And also tell us a little bit about your background. Where are you from?
I'm from Adel, Georgia, born and raised.
All right, small town, USA. I'm from Nashville, Georgia, so we were rivals.
That's right. Absolutely.
But now we're on the same team.
That's right.
I'm from Lakeland.
Okay, we have the trifecta here, you
Small
guys.
town girls right here. This is what it is.
Representing the rural
Communities.
areas.
Yes.
Exactly.
Hey, I like
showing
to
them
say,
what we can do.
Yeah, I like to say some of the smartest and brightest people come out of rural communities.
Yeah,
a lot of our physicians are even from smaller towns, and I think that's so. It's just awesome to see that it doesn't matter where you grow up, where you come from. If you have the heart, you can make big things happen. So
that's exactly right.
All right. Well, tell us about nursing at SGMC. Kind of what do you tell us about the vast array, the role nursing plays at our health system.
Oh, gosh. So we have so many different avenues of nursing here. As we grow, you can pretty much pick any field you want as far as nursing goes. We've got outpatient, inpatient. We've got the clinics. So anything that somebody, if they'll come here, we can find a fit for them, a nurse, whether it's a new grad or an experienced nurse. So we just cover a lot of ground. There's over 900 nurses in our organization, and so we've got 4 different campuses. So main campus, and then we have our 3 smaller hospitals who are growing and doing great things. So we've got lots of opportunities.
And what about, tell us a little bit about the different levels of nursing, because a lot of people, just think nurse, they just hear nurse, and but there are different levels of nursing. You can have different roles. Kind of tell a little bit about what those are, maybe for someone who might be interested in getting a career in healthcare, but they don't really know what all's available in that realm. Maybe starting from like the CNA, and then moving up. Kind of what does that look like?
So we love that. We love when people come in and they want to just grow. They want to learn at the very beginning, like at the basics, and then just add to their skills. That makes a very strong nurse. So we love when people do that. We have opportunities as a CNA, which is a certified nursing assistant. Those are mostly over in our smaller campuses. Over here we have patient care techs. We have 1, 2, and 3. So it really depends on what level you want to be. Ones typically are at the bedside, primarily at the bedside. 2 and 3s, they have a little bit more responsibility, whether it's clerical or doing EKGs and that sort of stuff. So drawing labs. So as they progress in those, they can do more things. We have LPNs here. We have RNs. Our LPNs and RNs work side by side upstairs in inpatient. And then we have what we call our PCCs, which are our charge nurses. Everybody kind of looks at us crazy some days when we say PCC, but those are our charge nurses, and those are our leaders. Whatever shift it is, they are here. They're leading the pack. So, and then we have our nurse managers, and our nurse managers are truly. They're the workhorses. I mean, they are truly. You talk about me getting a lot of phone calls, a lot of texts. Those are the women and men who get the phone calls and the texts. It's all during the night, putting out those fires, providing guidance and support for their staff. So they do a phenomenal job. And then we have our directors, and they do a great job as well running their service lines.
I know you say putting out fires, but really you never know what a day in the life of a nurse is going to look like. And so I really think it's like organizing chaos in some sense, although it's, not necessarily chaos, but it's just that you never know what's going to happen. And so you have to be very flexible and constantly adjusting this or assessing the situation and moving on the fly. So I think tell us what a day in nursing looks like, because we don't know, because we did not choose that field. Mainly, Taylor does not like blood, and I'm probably not the best person with patients. I would need a lot of training. It's a special person to become a nurse.
It is a special person to become a nurse, and it also is very hard for a nurse to be a patient. So I'll put that out there. It's very hard for us to do that. So, but really you have to be, to your point, it's constant change. Even in a day, you may walk in and you think, I've got, whether you're in ICU, whether you're step down, or whether you're in med surg, or women and children, but you're constantly, you may come in and you have your assignment. Your patient leaves and then you get another patient. And then another patient leaves and you get another. It's just constant turn over, because we are moving really fast, trying to take care of the patients and make sure that their needs are met. So you have to think outside the box. There's always, to your point, each patient, you have to have individualized care. Yeah. So each patient requires something different. And a nurse has to be able to understand that, be able to read the patient sometimes when they can't speak, and be able to just anticipate their needs, and then be able to communicate that with the physicians or whatever ancillary department needs to be contacted. So it is constant movement. They are on their feet a lot. They are on the go a lot. But they strive to take care of their patients. They work really hard to do that.
And the families, that's another thing, is communicating with the family. Because I know I haven't been a patient in the hospital, but a lot of my family members have. So being able to come in and communicate with the family member and making the family member feel safe, and okay, because we're always scared and, on edge. And I know that can be difficult to deal with.
You're exactly right. And we say that all the time. Communication is vital, because if you don't know, then your mind starts wandering, and you don't know what to anticipate, or you're anticipating the worst when really it probably isn't. But people just, if you don't know, your mind just kind of goes everywhere. And if you don't know healthcare, it really does. So sometimes we forget that, and that's something that we try to make sure everybody remembers, is just to keep that family member informed. We invite and encourage people to visit, to stay. We love when families stay with their patients or with their families, and then also call us. We're happy to talk to them on the telephone, give them updates, that sort of stuff. So we try to keep engaged with everyone.
Yeah, I think I'm an annoying family member. There's probably different categories. But I'm one of the ones who will call and, stay and try to get answers every 5 minutes if I can.
That's fine. That is fine.
At least you're engaged.
That's right. That's right. We know that patients are being cared for when they leave. We know who that person is. If we need you, we know to call you. So that's great.
What do you think makes a good nurse? I'm sure it depends maybe some on what department they're in, because different departments need different things maybe, but What do you think makes a good nurse?
Heart. You have to have a heart. You have to have the love for it, because it is very demanding. It's very hard. And if you love it, the day goes by. It's very rewarding, but you have to have a heart for it. That caring component.
Yeah, you won't last if you don't have that, because it won't be worth it to you.
Because you can endure those hard days a lot of times just because you know you're doing the very best for that patient and what's needed. But if you don't have that heart, sometimes it's very difficult to stay in that profession.
Yeah.
And to stay in that job.
And speaking of nursing profession as a career, what kind of opportunities, I know we kind of mentioned it, that we like to see our nurses grow or do different things to retain them, because we want them to stay within our health system. I know we interviewed several nurses a couple years ago, and when we asked them their story, a lot of them had like started in different departments but ended up in different areas. And I thought that was unique, because it's like you can go into a career of nursing and then you have so many options of like what type of nursing you choose to do. Which I think is a benefit, because if you don't necessarily like something, you can choose something else. But what do we do specifically here at SGMC to kind of cultivate that, making sure their nurses are in the right place and cultivating their kind of journey through their career?
Yeah. And it's very hard to come out of nursing school and really understand what you want to be. You think you know until you get there.
Yeah.
Some of them have their mind made and it's perfect. That's their goal, that's their dream. They've got it covered. And then some get, to your point, they get up there and they're like, wait a minute, this is not what I thought it was going to be. Hey, I think I'd rather be over here. So we do have some movement. Yeah. We do. One of the biggest things that we have is the residency program that Shug Pless leads, who is just phenomenal. I think she's been on your show, so she's great. But she has a residency program, and it's a 12-month program. And it helps the nurses grow not only to understand what their role is, but just in general give them the support that they need. And she happens to be in my office. She's got across the hall from me. And it is amazing, the staff, the new nurses that come in and talk to her just to get a word of advice. So I think that's probably our biggest. We have a lot of other programs. We have a skills residency, and that's really to give them more of the hands-on that they may have missed and in school, because it is, you have 2 or 3 days here or 2 or 3 days there. Yeah. So it's kind of hard to capture everything that you need to be on the job and doing what you need to do. So Shug
is kind of like the career counselor, like at a college, or advisor. You know how when you're in college, you have an advisor that kind of helps you navigate the
She is a
system.
lot of that and a lot more.
Yes.
A lot more. There's a lot of love there. She loves that. She loves nursing.
That's awesome that we have that. And that you have that support.
She's a nurturer for sure.
And I love having, we've had Miss Shirley Garland on our podcast before, who's on our board, who is also a nurse. And I think having people in our leadership team and in our on our board that have been bedside nurses that understand that role and they can advocate for what we do as an organization for our nurses, I think is truly important, because it is a special and dynamic. It's changing every day.
Every day. And as we grow, it's just changing every day.
And that kind of leads me to virtual nursing. That's a new program that we just launched. You want to tell us a little bit about that?
We are super excited about that. We feel like that's going to really help the nurses as far as like giving them a little time back so that they can communicate more with the staff or patient, and that just gives them the support that they need. So we've got several nurses hired. We have our own virtual program now, so we're very excited. And their role will be basically to go in and help with admissions, discharges, help with that medication reconciliation, which is huge. It's a safety issue, and it's very time-consuming for staff. So we're excited about that. They help with care planning, which is also very time-consuming. So and just another set of eyes in that chart, too, to help catch things that they may see that maybe the nurse missed. She was doing something, got distracted with patient care, need to come back. So it's just a really great program, and I think it's something that a lot of hospitals around us are not offering right now. So we're very proud of that. And we tried to make sure it was right before we launched it out.
Yes, because it's been in the works for a while now.
It has. About a year.
When I first heard it, I thought, virtual nursing, now how is that going to work? That cannot work. That does not sound safe. That does not sound right. So not to be confused with like telehealth visits.
Right.
So this is a nurse that actually is in our facility, is familiar with our facility, familiar with the staff, but they're not necessarily in the room with the patient. Right. So they're pulled in. The nurse or
the primary nurse.
Yeah, the primary nurse for the patient who's physically there pulls the virtual nurse in and makes introductions, and they start having conversations while the other nurse is doing like physical examinations, still there. So it's not a replacement.
IV started, all of that stuff.
Yeah, not a replacement of the physical nurse. I don't want that to get confused, but more so just an added person that's there that has time to sit and have those critical conversations with the patient and don't have to feel rushed.
Yeah, and discharge is very important because you've got all the medications, their post-op care, appointments, all of that. So they have the time to take it and just make sure that the patient understands their medications, when their doctor's appointment is, and then just the follow-up care in general. And so, in any questions. So, and then if they find something that they feel like the primary nurse needs to know about or follow up with, whether it's with the patient or with the family, then she'll follow up with the primary nurse and say, hey, can you follow back up with them? This is what they're asking for. Or she'll even call the doctor herself and ask the doctor questions for them.
Yeah.
So it's really
So you basically get two nurses for one base. It's an extra nurse. It's not a replacement of a nurse.
No,
it's an extra nurse.
No, it's not any replacement for the bedside. It's just helping them.
And the bedside nurses are loving that, right?
Oh, absolutely. Yeah. It's just enhancing the care.
Yeah, very good.
And I got a chance to talk to some of the team, the virtual nurses that piloted it, and the staff. And they did say that the staff are loving it. The patients, some of the pilot patients were a little apprehensive, but then they like it because, they do have that access there all the time. And also, one cool thing I thought, the virtual nurses can even call the family if the family is not able to be there. They can call the family and explain to the family, everything that they've explained to the patient, so they get to be kept in the loop as well.
Right. And we're working on trying to merge that, so when we do the discharge or even the admission, whatever it may be, they can call in and we can merge them into that call. So we're excited about the possibility of being able to do that.
Yeah, so,
make a difference.
But ultimately, it's going to enhance patient care. Yep. It enhances nurses' satisfaction. It gives our nurses a little bit more time back on the floor to do the things that they need to do. So very cool to see that. And I'm interested to see, what even evolves from that. But very shout out to those teams for taking that on and launching that, because I'm sure, anytime it's something new like that can always be a little challenging because you have your habits that are kind of set and but being open to always evolve and make things better, I think that's really cool.
And we have a great team. It's really a diverse team. We've got a few that actually worked here that decided they wanted to move into that role, that has years of experience. And then the nurses that were hired outside the building, they've got a lot of experience. Actually, one was, was a virtual nurse. So.
A very cool program to add to our...
yeah, definitely.
Yeah.
I think, so my background was in education, so I was kind of curious about we have a great pipeline for new nurses right here in our community with Wiregrass, Georgia Technical College, and Valdosta State University. So they both have RN programs. I think Wiregrass has LPN and RN, and then VSU has RN where you get your bachelor's degree. So how do we work with those two institutions?
We actually, and we have ABAC. We work closely with ABAC as well.
In Tifton.
So Shug plays a big role in that. She is really the liaison between us and the schools. Has a really close relationship with those instructors. So, basically she's a big player in that.
Yeah, because you start developing those relationships while they're in school, obviously, because they're here doing clinicals and rotations and things of that sort.
Shug's been going to the graduations and helping with pennants and doing some of the awards and stuff that we give out during graduation. So
let me ask you this: because I forgot I wanted to do it before, but what inspired you to become a nurse? What's the history there?
Actually, I come from a long line of nurses in my family. I have cousins that are nurses, and then I have 2 sisters.
Okay.
So I have a sister who is a banker, or was. So when I decided I wanted to come out of school, I went that route. I thought accounting. Oh no! So my other 2 sisters really encouraged me to look into nursing, and it was just a perfect fit. So that's kind of my inspiration was my sisters. Mm-hmm.
Yeah. And what's the most gratifying thing about your job as it is today? Would you say?
As it is today, I think just being able to be that firefighter, and to be able to help break down any barriers that the staff may have or nursing leadership has. It's as we grow, and I'm so excited about all the growth that we have and the different innovations that we're bringing into the building. So I think just being able to be that voice for them is probably the most rewarding thing.
And it's so important because the organization is so dynamic, and we start wanting to make things happen, want to make decisions, and oftentimes you can make decisions in silos, not thinking about how it impacts all the other things. So I know there's been several times you've been like, hold up, wait a minute, this, and we're like, oh yeah, because I mean, it's important to have all of those perspectives at the table because it matters. So I think you do a good job of that. But
like Mr. Dean says, we are a nursing organization.
That's right. Absolutely. We could not do it without our nurses. So we certainly thank them for all that they do each and every day.
Yep, agreed.
Is there anything about, the future of the direction we're going that particularly excites you as far as nursing is concerned? Any opportunities that you see?
Well, the most obvious thing would be our new tower. That's exciting. The growth that we'll see, being able to keep our babies here and they won't have to be transferred out, that's going to be amazing for the families because that is for some families that's you want to stay close to home, and some are just not able to make that trip to wherever their babies are transferred to. So being able to do that and increasing that level of care that we give in the NICU, that would be great. And then looking at the ED, being able to expand the number of beds, the capacity, and then the care that we're going to provide there. So all of that is very exciting to me.
Very awesome things happening there. And we'll see that opening up here in just
in a blink of an eye.
And a half. It will absolutely be a blink of an eye the way it goes. Well, Taylor, you want to ask the last question? Did you have something else?
No, I had another one before we wrap up. Well, we talked a little bit about recruitment and all that stuff, but what about? I'm sure we have a lot of open positions. I feel like we're always hiring nurses. We always need more nurses. So what would you say to encourage someone who's looking for a nursing position to come apply here at one of our locations?
So I think the growth that we have and the opportunities is endless. So the compassion that we show to people, not just to our patients, but within we're like family here. So I would encourage them to come here because once you walk in the door, you're family. And I think that we could we nurture our nurses, I think is one of the biggest things that we do.
Yeah, our this past year we formally introduced a strategic priority to be unparalleled place to work. And I think we're making great strides because we know that people have choices in where they decide to work, especially in nursing. And there's a nursing shortage nationwide. And I often hear, well, they need more nurses. They need more nurses. And yes, we always need more nurses, but it's not from a lack of wanting to hire them. We will, if you're a good nurse and want to come work here, come
and I think we can have most anything, that they're interested in.
But we also want good nurses.
Yep.
And we want that for our patients. Well, our patients deserve the very best. So it's not just about having any nurse. We want the best nurses, the one who have that heart that you talked about earlier. So if you've got heart and you're looking for a career in nursing, join our team. I think with all the strides we're making,
they will be fulfilled. I think that if they've got the drive and the heart for it, this will be a place that they will enjoy being.
And there's a lot of opportunities.
And appreciate it.
I mean, we have 4 campuses. I don't know how many clinics you could work
nearly
in a clinic.
40 clinics.
Yeah, so you don't have to be at the bedside. You know, you could be at a clinic or, you know.
Never a boring moment. There's always something.
There's a lot of different shift availabilities too, as far as
we're trying
if
to
you
be
want
more
to do
flexible
different.
with that as well, offering different options as far as work schedules and stuff. Yeah.
Very good.
So now I'll ask my last question.
I'm glad you added that other one in there.
It's probably the hardest. What is it?
No,
No.
not for you. You probably know this one.
What is your favorite meal to eat here, either in the cafeteria or the Allspice?
Recently, I'm trying to be a little bit more healthy, so I'm going to say the salad bar in the Spice.
The salad bar in the Spice is phenomenal.
It is. It really is.
So what's your guilty pleasure meal?
French
If you
fries.
weren't being
French
healthy.
fries.
Hey, if I'm having a stressful day, that's comfort food.
Yeah.
So I'm going to go and say, are the French fries hot? Yes, they are. Okay. Load me up.
Yeah.
So,
I totally can get behind that.
Yeah, but that salad bar is amazing because there's so many. There's like 20 options of things you can pile onto your salad, so you can make it the colorful treat.
and different types of lettuce. I mean,
Yes,
I'm like,
I love that too because I don't just like the regular iceberg lettuce.
yeah.
We need spinach or romaine or the leaf, the leafy stuff.
Yeah.
This does not excite me at all.
The salad doesn't?
No.
Now I'm picky about what goes on it, but I do like it.
All right. Well, Cherise, we thank you so much for coming on. I know this is not your favorite thing to do to get on the airwaves.
That is
but
so true.
We
But
appreciate
thank
you doing
for
it.
inviting me, and it's been a pleasure to be here. So
Yes,
thank y'all both.
thank you. And thank you to all of our listeners for tuning in. And please do like, subscribe, follow us. And if you have any questions, you can submit those at sgmc.org/podcast.